A look at the future of medicine with some significant health studies that are in the early stages. ABC News medical correspondent, our friend Dr. Darien Sutton, is here to break them down for us. Thank you for being here, Dr. Sutton. We always love having you. Let's start with Neuralink. So one man has received the company's first ever implant to help him control a computer with his thoughts. What does this mean for the future of implants moving forward?
A breakthrough, a lot of potential here. So Neuralink, it attaches over 1,000 electrodes to the brain, connected by tiny little wires to a device the size of a quarter, all invisible to the naked eye when it's implanted in the brain. And that helps the person control things like computers, also can control possible prosthetic devices, helping people potentially with paralysis, amputations, and even with movement disorders like Parkinson's disease. One complication, however, is that the first patient, the first participant, seemed to have a complication of those threads retracting or malfunctioning, causing the system to operate in a way that it wasn't supposed to. Now, the owner or the creators of Neuralink have said they've gone back and they've troubleshooted this problem to adjust the software, but we're still going to wait to follow. This is very much in the early stages of that research as we enroll more participants in that and follow those cases. But nonetheless, this is incredibly promising.
Yeah, and that patient, by the way, said that this has already changed his life, what he's able to do with it. Another topic here, a potential new drug to treat the symptoms of menopause. What do we know about that?
This is also very, very promising. This is the potential drug that also is a non-hormonal medication to use to treat vasomotor symptoms of menopause. The common name of that is hot flashes. These are what patients define as debilitating symptoms, feeling like you're stepping into a sauna, leaving patients feeling anxious, leaving them feeling claustrophobic, and also disrupting their sleep. The complication here, or the problem here, however, is an access to, or barrier to access. Unfortunately, many insurance providers are not covering the first approved medication to treat menopause. And so although this is in that early or that phase 3 stage, waiting FDA approval, we're hopeful that we're going to see more access, hopefully more ability for patients to get the medications that they need, because menopause is something that an estimated 2 million women enter into every year. And it's estimated that a third of women live in menopause, or women live a third of their life in menopause. So hopefully we will see more access, more medication, more treatment.
How many people know that? It's estimated women spend a third of their lives in menopause?
Yeah, well, if you use 50 as a proxy for the beginning of menopause, the average age or life expectancy is 81, so that's a third of your life.
That's incredible. That's incredible. Okay, so let's talk about HPV, because I know you've been following this. The FDA has approved this self-test for women for HPV, and basically collecting their own samples at doctors' offices. What do we know?
So this is something that I think is going to be really helpful, basically in terms of access. So HPV, human papillomavirus, a persistent HPV infection, is responsible for the majority of cervical cancers. So screening for HPV is forever important. Now, this, unfortunately, is only available right now in clinical settings. And so it's a self-swab available in clinical settings. But the hope is that patients will then be able to take it home, which will be more convenient, more private, and provide more access. And so we're hopeful that we'll be able to see this. But as a reminder, screening for HPV starts at the age of 21 and then can increase or happen every 3 to 5 years depending on what's available to you. But screening is forever important, and if you haven't done so, you should go out and do it.
So important, and you're always following what's new in medicine. Dr. Darien Sutton, thank you so much for being here.
This was a great little chat.
It really was, right?